Are you still masking in 2022? Are you aggressively using hand sanitizer and practicing and implementing social distancing protocols in your life? If so, I think you might want to watch this video because guess what? New research shows that every successive variant of SARS-CoV-2 is increasingly more benign. In fact, Omicron is about 40 times less virulent or pathogenic compared to the original ancestral strain. But I think this information is important for people to hear because every time I go out in public, every time I drop my daughter off at school, I still see people wearing gloves and masks and masking their children. Yet they're making really silly health choices that actually compromise their immune system and reduce their robustness against combating pathogens like influenza, RSV, and even COVID-19. So it's important to recognize that it's no longer March 2020. I know for some of us, we want to live in fear. We want to pretend that we need these hand sanitization protocols and masks and much more. But I want to share with you this data. There's a report. It's titled The Decline of COVID-19 Severity and Lethality Over 2 Years of the Pandemic. I know the media hasn't done a good job of sharing this information, so I want to just convey it to you in very simple terms. Every single variant that has emerged from SARS-CoV-2 is increasingly more and more benign, less lethal, meaning the probability of you dying, getting hospitalized, or landing in the ICU is iteratively lower and lower. And essentially, we've done videos on this exactly 1 year ago to the day when Omicron was first characterized. We talked about the law of declining virulence. As pathogens become more transmissible, they lose their capacity. They become less virulent. And I know the media hasn't done a good job about it, so let me share with you these statistics from scientists in Italy. They say, we found the severity of SARS-CoV-2 infections has progressively declined throughout the pandemic, with the infection fatality ratio in 2022 falling close to levels of the 2009 H1 pandemic influenza, with an estimated infection fatality rate of 0.02%. So just ask yourself, if you're still wearing masks out in public, if you're afraid to go to the grocery store, if you have a hand sanitizer bottle strapped to your backpack, did you do that in 2009? Because if you didn't, you're being logically inconsistent now. And I hate to break the news to you, but again, what you should be focusing on is exercise, nutrition, vitamin D, shoring up those relationships that you've neglected over the past 3 years, because we know that social isolation and not having close friendships actually impacts our immune system, impacts our mental wellness. We know mental well-being is at an all-time low. We know obesity rates are unfortunately at an all-time high. We know cardiometabolic disease is impacting some 95% of Americans, yet so many people are still focused and still operating on a 2020 operating system. It's time, friends, that you ditch the mask, you ditch the hand sanitizer, and you allocate that intention towards being more well with regards to your metabolic health, your nutrition, your vitamin D. Because here's more statistics from these Italian scientists. They say compared to the first pandemic wave, we estimated a 20 times lower probability of hospitalization, a 36 times lower probability of ICU admission, and a 40 times lower probability of death during the Omicron phase. Okay, I say this because just the other day, I had a woman who was wearing a mask. She saw me with my daughter and she crossed the street into traffic to avoid coming in contact with us. Does she know that Omicron, which needless to say, is the widely circulating variant, its probability is 40 times lower. The case fatality rate is 0.02%. The odds of her getting hit by a car or struck by lightning are probably higher than dying from Omicron, yet she's behaving like it's March of 2020. Now, I'm a little passionate about this because I see so many people allocating so much of their intention towards preventing exposure to a pathogen, but willingly causing chronic disease with their own nutrition and lifestyle choices. So there's a mismatch and a huge logical inconsistency here. Furthermore, I know you like statistics, so let's talk about it. The Italian scientists say we estimate the probability of death given infection at 1% in the second ancestral phase, which is a 55% reduction compared to the OG variant, and then a 0.44% risk of death during the alpha phase. And they go on to say with the Delta phase, it actually decreased. Remember, let me pause. The media made Delta during the summer of 2021. This was, oh my gosh, we need to extend the emergency authorization and extend these mask mandates, and we need to utilize OSHA to regulate employers and force you to get a vaccine. Well, actually, Delta was linked with a lower probability of death compared to the OG strain. In fact, the scientists say the reduction is some 76% lower odds of death with Delta. The media didn't tell you that. Now, when it comes to Omicron, this is quite significant. The probability of death if you get Omicron was 0.05%. So every variant is linked with a lower and lower probability of death. Now, some of you are saying, Mike, I'm thinking ahead of you. That's because, of course, the immunizations. That's because of this. That's because of the mandates. No, it's because the virus changed. Again, it has to do with the inverse association between transmissibility and pathogenicity. As pathogens become more transmissible, they lose their pathogenic virulence. This has been long known since the early 1900s. Scientists and people who study microbiology have long known this. It's just you didn't hear about it from NPR, CNN, or New York Times or Washington Post. For some reason, there was a push to not disclose this information. And I remember reading your comments when I talked about the law of declining virulence. You called me all sorts of names in the comments. I'm a conspiracy theorist. I'm a science denier. And here we are now, and we have the data to show that Omicron and Delta were actually less pathogenic and virulent compared to prior strains. And so again, the law of declining virulence stands true today. It stood true throughout the whole pandemic and other infectious disease pandemics like the Russian flu back in the 1800s, late 1800s. You can talk more about that. Now, common sense would suggest that if humans were able to survive the Spanish flu, the Russian flu, and H1N1 flu, then why would we think that SARS-CoV-2 would somehow defy all of the historical precedents before it when it comes to pathogens and behave differently? It has behaved. In fact, this virus, as it infected more people, it learned how to increase its ability to become more transmissible while losing its virulence. Okay, so I'm sorry that the media didn't tell you that, but here we are. We have now data to actually reaffirm that. And you can see with these images convey the story quite well, where you see the probability of hospitalization declining with each successive variant. And of course, Omicron being the lowest, and then probability of ICU admission and probability of death. The probability of death from Omicron is infinitesimally small, okay? So remember that when you're getting invited to go to a concert, to a wedding, to a social event, and you think, well, what about COVID? What about Omicron? Yeah, what about it? It's not going away. It's not going away. So live your life. Focus on your diet, your exercise, vitamin D status, social connections. Focus on sleep and stress reduction strategies. Those are the things that will extend your lifespan, my friends. Those are the very tactics that will improve your immunologic health, whether it's getting severely sick from Omicron or some other pathogen. We cannot totally avoid pathogens. That's part of living. That's the cost of living. And so what you need to do every day is focus on those aforementioned lifestyle strategies to become more resilient. So hopefully you found this data helpful, maybe reassuring for some of your friends and family that are still acting as though it's March of 2020, because it's not. The pathogen that was circulating then is no longer here. It is a more benign pathogen. Although it is more transmissible, it's more benign, which should be good news. So friends, if you enjoyed this video, I would very much appreciate it if you share this with a friend. Hit that like button, leave a comment below, and if you want to wear inspiring t-shirts like Make Natural Immunity Count Again, the germ is nothing, the host or the terrain is everything. This is a quote by Louis Pasteur. Check it out in the links below. You can save using the code podcast over at myoscience.com. That's myoscience.com, myoscience.com. Save and buy one of these t-shirts to inspire meaningful health promoting conversations with the people that you care about. Until then, we'll catch you on a future video down the road. Bye now.